So pre-existing conditions versus conditions due to the pregnancy. Okay, what are these pre-existing conditions? It says here in the guidelines that Chapter 15 distinguish between conditions of the mother that exists prior to pregnancy and those that are direct result of pregnancy. When assigning codes from Chapter 15, it is important to assess if a condition was pre-existing prior to pregnancy or developed during or due to the pregnancy in order to assign the correct code. Okay, so the most common diagnosis or conditions that I can think of top of my head, guys, that you need to make a determination whether they are pre-existing or if they occur during pregnancy are diabetes and hypertension, because there is something that is called gestational diabetes or gestational hypertension. Okay, so now when you talk about gestational, these are conditions that occurred or developed during pregnancy, and quite a few conditions are the ones that that may appear or that may occur during pregnancy. And hypertension is also one of those. Remember the scenario that we had last night, the eclampsia. Eclampsia, by the way, guys, is a severe form of hypertension where patient's blood pressure is through the roof. That's what eclampsia is. And there are hypertensions that only occur during hypertension because when patients when ladies become pregnant, there are so much changes that they need to deal with, that the body is adapting to. So in that case, guys, there are many of these manifestations or symptoms that are most likely to happen during pregnancy, and we call those conditions gestational. Okay, so let's continue our reading here. Categories that do not distinguish between pre-existing and pregnancy-related conditions may be used for either. It is acceptable to use codes specifically for the purpurium with codes complicating pregnancy and childbirth if a condition arises postpartum during the delivery encounter. Okay, so there are those conditions that do not necessarily occur or that actually don't matter whether they're pre-existing or gestational, because the guidelines say you may use them either or. Okay, you may assign the gestational or you may assign the non-gestational, which is pre-existing. They don't really matter because there are conditions that do not really affect pregnancy. Okay, pre-existing hypertension in pregnancy, category 010, pre-existing hypertension complicating pregnancy, childbirth, and the purpurium includes codes for hypertensive heart and hypertensive chronic kidney disease. So these pre-existing hypertension in pregnancy, guys, is almost like the regular hypertension when you're assigning codes for that, just to make sure that you assign hypertension as a complication to pregnancy. Because again, guys, we always consider any condition or any diagnosis or when a patient gets pregnant as a complication. So if it is pre-existing hypertension, then it is considered as a complication to pregnancy as soon as the patient becomes pregnant. Now, the code that is suggested here is 010, right here. Okay. So when assigning one of the codes, 010 codes that includes hypertensive heart disease or hypertensive chronic kidney disease, it is necessary to add secondary code from the appropriate hypertension category to specify the type of heart failure or chronic kidney disease. So what does that mean, guys? So you still have to assign the other hypertension codes. Let us try, guys. Can you please grab your book and let's go to this code 010, the subcategory 010. Everybody please do that and do as I am actually doing it now. I'm going to 010. And let's see if there are additional instructions that come with it. Okay. 010. Okay. So I got here. O10. Okay. Pre-existing hypertension, complicating pregnancy, childbirth, and the puerperium. When you're assigning 010.1, look here, guys. 010.1, I'm on page 893. There is an instruction that says use additional code from I-11 to identify the type of hypertensive heart disease. So what that actually means, guys, that 010, the 010 code is not enough. Okay, 010 is not enough. When you assign a code 0101, let me, where is my, okay, I'm looking for my pen here. So this is a category code for hypertension, 010. Okay, so if it's, irregular hypertension, pre-existing hypertension in pregnancy, this is the code 010. As soon as you assign the code 010.1, what you're basically saying is that patient has hypertensive heart disease. So what does that mean? So you are going to apply the same guidelines as we have learned from, the circulatory chapter, right? So 010.1 is hypertensive heart disease. So you have to determine whether this is heart failure or whether this is hypertensive heart disease that does not have heart failure, because you are going to assign also the code, the additional instruction says assign also a category code that starts with I-11. Remember the I-11, guys? We had this discussion some weeks ago that I-11 is a hypertensive heart disease. If a patient has hypertensive heart failure and pregnant, then your code is going to look like 010.1 and I-11.0. Let me see if 010.1 is a complete code. 010.1, it's not a complete code, but it says here for the first trimester, you are to assign 010.11, okay? 111. That is pregnancy, okay? Or HTN pregnancy with heart failure on first trimester. So this is how it looks like, guys. Does that make sense, guys? So now when you assign the I-11, remember, as soon as you assign the I-11.0, if you go to I-11.0, it will tell you to assign also the code for heart failure. So if this is hypertensive heart failure, then you got to assign also the code for I-15.9. Does that make sense? I-50.9. So we're talking about hypertension that is pre-existing. Just remember, guys, the guidelines that we studied or we learned from hypertension is also applicable to the pregnancy or the OB cases. Okay, so just make sure that when you're assigned the code for this type of conditions, you always go to pregnancy complicated by. Or if the book allows you to go to hypertension then pregnancy, you can do either process, either way. But just remember that your primary diagnosis has to start with the OB code, which is an O, in this case is 010. Okay, let's continue. Any question, guys? Okay, so let's continue here. What about fetal conditions affecting the management of the mother? Codes from categories 035 and 036. Codes from categories 035, maternal care for known or suspected fetal abnormality and damage, and 036, maternal care for the fetal problems, are assigned only when the fetal condition is actually responsible for modifying the management of the mother by requiring diagnostic studies, additional observations, special care, or termination of pregnancy. The fact that the fetal condition exists does not justify assigning a code from this series to the mother's record. Okay. So 035, 036, these are category codes, guys, for a case or a scenario when there is an existing fetal condition. And because of that fetal condition, guys, the management to the mom is kind of like modified, or there's some special or a type of treatment that is required to take care of the mom. Okay, so that the mom will be able to be able to carry the baby to full term. So that's what the guidelines are trying to tell us, that make sure that you assign that 035 or 036 because of that fetal condition that actually modifies or maybe alters the management of the mother. Not necessarily alter, but what I'm trying to say is that there's a special type of treatment that is given to the mother, so that the mother and the fetus will be able to go through full term. Okay. I don't know, guys. I'm just thinking that anytime there is a complication to the fetus, okay, anytime there's a complication to the fetus, I would say that there should be a special type of care to be given to the mom. Does that, I mean, do you guys agree? I mean, anytime, like, if the fetus has a weak heart rate, like fetal deceleration, if the fetus is not showing any, like, regular development, there has to be some type of a special care that should be given to the mom, right? So that's what I'm thinking. Like, I can hardly think of a condition that does not really modify the management to the mom, or if there are some more types of special treatment that should be given to the mom, that should be applied, right? If there is something needs to be monitored, or to be the fetus is kind of like affected, so there has to be some special type of management to the mom. Makes sense, right, Karen? I mean, like, I haven't heard of a fetal condition that does not affect the mom. It always affects the mom. Okay. So in utero surgery is a very rare case, but if it happens, this is the rule here. In cases when surgery is performed on the fetus, a diagnosis code from category 035, maternal care for the known or suspected fetal abnormality and damage, should be assigned, identifying the fetal condition. Assign the appropriate procedure code for the procedure performed. No code from Chapter 16, the perinatal code, should be used on the mother's record to identify fetal conditions. Surgery performed in the utero on fetus is still to be coded as an obstetric encounter. So this is a very rare case, guys, where doctors or physicians will perform or would perform a surgery while the fetus is still in the uterus. Very rare, right? And this is one of those examples, I guess, non-traditional or maybe an outlier type of cases where a fetus the fetus needs some form of surgery while the fetus is still in uterus. Very, very rare. So what does the guideline say? Okay, so the guideline said an O35 should be assigned, okay, for this case, and assign the appropriate procedure code for the procedure performed. It's still assigned on the as an obstetric encounter. See here? This is still an obstetric encounter. It's not a perinatal. Do not assign a perinatal codes, which, you know, chapter 16 is the next chapter that after we are able to, or after we have completed this chapter 15. Okay, so I'm not going to pay so much attention here, guys, because this is a very rare case. Okay, but just the same, read it. What about HIV infection in pregnancy? During pregnancy, childbirth, or the puerperium, a patient admitted because of an HIV-related illness should receive a principal diagnosis from subcategory 098.7. This 098.7, guys, if you go look at pregnancy and complicated by HIV, this is the code you are going to see. Okay, human immunodeficiency or HIV in pregnancy, again, starts with letter O. Now, human immunodeficiency disease complicating pregnancy, childbirth, and the puerperium, followed by the codes for the HIV-related illness. If a patient is admitted for any HIV-related illness, then you got to also assign that other codes for other conditions. Patients with asymptomatic HIV infection status admitted during pregnancy still has the 098.7 code and assigned the Z21. So it's pretty much repetitive, guys, from what we have already studied, if you guys noticed that, right? So just pay attention on the fact that the OB cases, guys, are always treated differently, right? I mean, in terms of coding, you want to make sure that you attribute that condition as a complication to the pregnancy. Now let's go to diabetes mellitus in pregnancy. Diabetes mellitus is a significant complicating factor in pregnancy. Pregnant patients who are diabetic should be assigned a code from category 024, diabetes mellitus, pregnancy, childbirth, and the puerperium first, followed by the appropriate diabetes codes E08 to E13 from chapter 4. So last night, guys, we had a case. One of the scenarios that we answered as actually a diabetic patient. And here in these guidelines, it's being discussed that diabetes is a common condition that may occur or may appear when a patient gets pregnant, or it can be a pre-existing condition. So the code, the subcategory code, the category code that is assigned to that is 024. Now you have to make sure or make that determination whether this is a pre-existing or whether this is a gestational diabetes, because the pre-existing diabetes, I believe the scenario that we did last night is that after you assign the O code, the 024, there is an additional instruction saying you have to assign also the additional code for the type of diabetes, whether it's E10 or E11, right? From E08 to E13. So what that means, guys, do not settle only with the 024 code, but you want to make sure that you also assign the appropriate type of diabetes. If a patient is type 1, then assign the type 1. If it's type 2, assign a type 2 as additional diagnosis. E10. Okay.